have two more to go. Next is Dr. Saurabh Patpar. Then welcome, sir.
Thank you, ma'am. Thank you.
Looking forward to learn something from you.
Thank you. So my paper is about innovative method of sidewave sculpting for nucleotomy in cases of hard posterior polar cataracts. I am the presenting author, Dr. Saurabh Patpar from Nandadip Eye Hospital. So as we know that PPC have always been a challenge to cataract surgeon because there is always higher propensity for posterior capsular rupture, and that may be because there is a possible adherence of the PPCs to the posterior capsule. So incidence of complications have definitely reduced, but still we have to plan a strategy for that. Now these are the popular strategies which have been already described. For example, to avoid a large anterior CCC so that we have a good optic capture, we can do a oval CCC as well. Avoid deepening or shallowing of the anterior chamber during the procedure. Avoid hydrodissection but perform hydrodelineation. There should be no nucleus rotation during the maneuver as far as possible. Use low vacuum, low flow rate, and avoid any capsular polishing at the end. In this study, we use Daljit Singh classification of posterior polar cataract, where type 1, 2, and 3 are showing different characteristic of posterior polar cataract. But in this study, we have included type 4, which is combination of different signs along with nucleus sclerotic cataract. Now, purpose is to introduce an innovative method of sideways sculpting for nucleus management in cases of hard posterior polar cataract. We included posterior polar cataract with nucleus crosses of grade 2 and above. We excluded the softer grades of cataract less than grade 2. The types of study was retrospective analysis over last 4 years. So sample size was 17 eyes from 17 patients who underwent surgery for cataract surgery with PPC. Single surgeon performed all the operations and sideways sculpting method is used. So in order to show the sideways sculpting method, I would rather show video because it's more of a more descriptive of the technique that I'm going to use. It's stopping here. Can you just start the video? You can start without the slideshow, that is also fine. Yeah, okay. So in this video, I'll be describing this innovative technique of sideways sculpting for grade 2 and above nucleus sclerosis of posterior polar cataract. This is a novel technique, has not been described in literature yet. So this is a soft gate cataract, which is very easy, I would say, as compared to a nucleus sclerotic cataract, because here we can go layer by layer and just aspirate the nucleus without need of any rotation of the nucleus. And this is what we commonly use because these are the cases which we commonly encounter where PPC is without much of a nucleus sclerosis. But what to do with PPC but a denser nucleus, it always poses a challenge. So in such cases, we can use this technique. So here first we do a standard trench, which is a straight trench which has been described, and then after making that first good deep at a good depth trench, what we do is we move the phacoprobe sideways without any rotation of the nucleus. So we make sideways sculpting of the remaining two heminuclei on both sides. So it's like divide and conquer method but without any nucleus rotation. You can call it in situ quadrant and the 4 quadrant method. And once we have this 4 quadrant, we very gently separate these 4 quadrants and emulsify. Just watch this in action. So this is the first trench which is done. A good deep depth of trench is needed, and now I am moving the tip sideways so that I create side trenches so that we have this plus sign, this classic divide and conquer sign, and then we split this nucleus into 4 parts. Okay, you can see the central part is still not completely split, and then you can take out these pieces one by one without need of any rotation of the nucleus and just finish the nucleus, and rest epinucleus and other management is same like other methods. So this is a slightly even denser cataract which I am showing. Again the similar technique is used. You can see sideways trenching. I am doing gentle separation of these pieces without dividing the central part which is taken out last. So once the 4 quadrants are there, I will just nudge them into the anterior chamber without any again rotation and just emulsify them and then finish the rest of the surgery. So this is a novel technique which can be used for posterior polar. You can go back to the in posterior polar cataract with denser nucleus, because that really poses us a challenge. Can you we shift. Go to the next. Okay. The cases were uneventful and without any complication. In one case, there was small opening in the posterior capsule, but IL could be implanted in the bag. So, I have 1 minute. Or finish it. So to conclude, the innovative surgical technique provide nucleus division without distorting or exerting traction on the weak posterior capsule. It's a useful technique for posterior polar cataract with nucleus crosses grade 2 and more. Thank you.
Excellent. So, lucky to ask you a question.
Thank you.
It's not a question actually. Is it that easy to sculpt sideways? Never thought of it.
Yes. In fact, it's much
even
easier.
if it's a straight tip.
Yeah.
Straight tip.
So even I tried it initially. This question was asked when I presented it first. So initially I tried everything with the Kelman tip and a torsional phaco. But later I tried with straight tip as well as with longitudinal phaco.
Okay.
It's definitely easier with torsional and angle tip. But it can be done even with the straight and with longitudinal. But longitudinal, it's slightly more difficult as compared to.
Is a 0 degree tip better or a 45 degree tip is better?
Yes, sir. 45 or 30 both are fine with this.
Both are giving equal results?
Yeah, of course, 45 will be easier to train, but if you are used to trench with 30 degree, that is fine.
My question is that how it gives, what is the advantage of it?
Yeah, so normally
what I understand from your presentation is that you are avoiding rotation of the nucleus.
Yes.
But so, when you are successfully doing double trenching, one straight and one sideways, you are having 4 quadrants.
Yes.
But when you are pulling up each quadrant in the anterior chamber or mid plane, you are having the same risk.
No,
unless you leave the epinucleus plate or some amount of cortical matter back there.
Yes. So if I analyze my videos with great denser nucleus with posterior polar cataract, the most common place where the nucleus starts sinking is when you try to rotate the nucleus. If you notice in the video, I never tried to do the the regular rotation. I just pulled the nucleus to the center, that quadrant, and emulsified. So it avoided that complete rotation of the nucleus, because if there is a adherence of the PPC with the posterior capsule, what happens? The rotation will tear that posterior capsule. That is avoided. Of course, if like in one case there was a capsular opening, but idea is we emulsified all the nucleus before there is a risk of any
you
drop.
Do capsular hydrodissection, only hydrodelineation.
Hydrodelineation. So all other steps will be standard steps. Thank you, sir. Thank you.
Yeah, you have a question.